Sometimes, as a civil surgeon, my patients want to know exactly what is tuberculosis. Tuberculosis is a disease caused by Mycobacterium. This is a germ that comes into the body, usually through droplets that are breathed in. If a person has tuberculosis in the lungs, they'll cough out these germs, and someone passing by them can breathe it in. Most often, the people that transmit the disease are friends or family, or even coworkers that have the disease. The most common way that tuberculosis is transmitted is through respiratory droplets. However, there are other ways that it can be transmitted. In the past, it's been transmitted in milk from infected cows and other secretions. When the germs are breathed into the body, they often hibernate in the lungs, and they can stay there for up to 20 or 40 years before they cause an active disease. The most common signs of a tuberculosis infection is coughing, sometimes coughing up blood, but you can also have night sweats, fevers, or chills. And sometimes tuberculosis will invade other tissue besides the lungs. One of the most common things is for the tuberculosis germs to invade the bones around the lungs or into the spinal cord and weaken those bones and cause a fracture. Tuberculosis is very common in refugee camps, in prisons, and in nursing homes. And so people from those populations need to be especially cautious about the possibility of tuberculosis infection. In fact, one of the cases of active tuberculosis I saw in my own practice was from a young child who was adopted from a refugee camp in Africa. When she came to the United States, she didn't have any symptoms, but the chest x-ray showed she had active disease, and this was confirmed when we did the sputum culture. The important thing is that if you do have active disease, that this can be taken care of by taking the medication and completing therapy. This can prevent the disease from causing consequences that have the potential of being fatal. Because people have tuberculosis and they may have no way of knowing they have the disease, it's important for the testing to be carried out.